Conjunctiva, as we all know, is the protective covering or the protective membrane that is present on the outermost layer, which is covering basically the cornea as well as the scleral epithelium. So there are multiple conditions that can arise in this particular layer. It can be subjected to the irritational purposes, which is basically the causing the irritation and the allergic conditions in the conjunctiva. Today we'll focus briefly on the cysts and the tumors conditions that can arise in this particular membrane over here. So first of all, the cystic lesions of the conjunctiva. So how do they appear? These cysts, how do they appear in the physical manner? And what will be the clinical features that the patient would be complaining of is again very important. History taking over here is the mainstay when you have a patient of cystic lesions, that is particularly concerning the conjunctiva of the individual. Obviously, the history would start off whenever we are basically going to take the particulars from the patient, including the age, the gender, the occupation of the individual, as well as the presenting complaints of the individual. In cases of cystic lesions of the conjunctiva, particularly, the patient would complain of foreign body sensation in his eyes, and particularly the irritation which is caused due to this foreign body sensation is in his eyes. And if the cysts are large enough, they can be visible even with the naked eye examination. So these would be the typical picture whenever we have these patients of cystic lesions pertaining to the conjunctiva of the individual. So you would basically go back into the history of all of these presenting complaints in these particular individual. The patient would obviously highlight that he or she may be suffering from one of the risk factors, being the allergic condition of the conjunctiva, or either it can be a chronic inflammatory condition of the conjunctiva. Whenever we are focusing or whenever we are talking about the chronic inflammations of the conjunctiva, they have their particular etiologies. For example, it can be due to the bacterial origin, it can be the viral causes, it can be the fungal causes, which can relate to the final picture of a chronic irritation that the conjunctiva has been subjected to. And due to this chronic irritation that has occurred in the conjunctiva of the individual, there would be the formation of this cystic lesion that has appeared. Again, the examination would start off from the limbus. Limbus is basically the junction of the cornea and the sclera. So if the cystic lesion is pertaining to the limbus of the individual, it is going to affect the visual acuity, obviously, and if it is just encroaching upon the cornea, again, it is going to affect the visual acuity, and that would be an additional point in the presenting complaints. On examination, obviously, there would be the features that would reveal the particular site of the cystic lesion in this particular patient. On one hand, we'd be notifying whether the patient is having the cystic lesion or not, and on the other hand, we'll observe whether there are these signs and symptoms of the irritational purposes in the rest of the conjunctiva or not. For example, for instance, if you look at this patient, the cystic lesion is lying near the foreignness, but still there are the irritational signs that are present on the rest of the conjunctiva. So these can be the signs and symptoms or the clinical features that you'd be looking for whenever you have this patient of cystic lesions pertaining to conjunctiva. Obviously, it's not always a particular picture or a classical picture of cyst that we note down in the conjunctiva. It can be a variant of cystic lesions. The person can have multiple clinical scenarios. For example, along with the cystic lesions, he or she may be suffering from superimposed bacterial or viral infections as well. So you have basically these multiple pictures or these multiple clinical features that the patient may be suffering from, and you have to focus them on, and you have to record any particular signs and symptoms that the patient may be having or may be suffering from. Now, the cysts of conjunctiva can be basically classified into different types. Obviously, these types are depending upon the etiological factors or the factors that are making the person predisposed to the development of this condition. On one hand, we have these lymphatic cysts of conjunctiva. Now, what can be the causative factors for the development of this lymphatic cyst? It can be the dilatation of the lymphatic system that is finally resulting in the lymphangiosarcoma, or it can be an isolated lymphangiomatosis condition that arises in the person. So basically, it's the lymphatics that are involved. And we all know that when we studied the histology of conjunctiva, if we can recall the features of the histological features, we know that we have an epithelial layer, and then we have the layer of substantia propria that is basically containing the lymphatics. So any dilatation that is related to the dilatation of these particular lymphatics lying in the substantia propria would result in the formation of cystic lesions that are pertaining to the conjunctiva. It can be the bulbar conjunctiva, it can be the fornical conjunctiva or the tarsal conjunctiva. Mainly, the fornical conjunctiva are more prone to the development of these lymphatic sorts of cysts that develop in the conjunctival region. On the other hand, we have the retention cysts. Whenever we say or whenever we categorize a conjunctival cyst to be the retention cyst, basically we are referring to the glands of Cross over here. So the glands of Cross are lying near the bulbar conjunctiva, and any retention of material in these glands, any blockage of the openings of these glands can result in the retention cyst that can develop in the conjunctival membrane. Now, there are a lot of infectious states out there which can result in the infections of the glands of Cross in an individual. It can be trachoma, it can be the infections due to pemphigus. So usually these are the most notorious infections which can basically lead to the development of retention cysts in the individuals. On the other hand, we have the epithelial implantation cysts, or they are also categorized as the traumatic cysts. Usually, this trauma occurs due to any surgical procedures that are performed. Now, what are the particular surgical procedures? For example, it can be the intrabulbar or the retrobulbar injections that can result in these epithelial transplantation cysts, as well as surgical procedures that are performed for the removal of pterygium in the individual. Pterygium, as we all know, it's basically the epithelial membrane that basically encroaches upon the conjunctiva, as well as it can encroach upon the cornea of the individual. It's usually a triangular fold. Clinically, it is identified as a triangular epithelial membrane, which is covering the conjunctiva and the cornea as well. So usually when patients present with this kind of a condition, which is known as pterygium, and they are surgically excised, trauma can occur to the conjunctiva, and that would result in this epithelial implantation cyst, which is also known as traumatic cysts in the individuals. Now we have the parasitic cysts, the subconjunctival cysticercis. It's another name which is given to the parasitic infestations that can occur in the conjunctiva of the individual. And again, it would result in the cystic lesions of the conjunctiva. It's again very important to take the history from the patient just to get to know any previous history of the parasitic infections or any lab investigations that has been performed on such patients. For example, Anemia is one of the clinical signs that is noted down in the parasitic infestations if the person is having one. So the lab investigations are very important. The history taking is very important whenever we are considering any of the risk factors that led to the development of cystic lesions in the conjunctiva of the individual. Now, on the other hand, the epithelial cyst, due to the downgrowth of the epithelium, they occur. This is basically, it can be a cystic change in the pterygium itself. So any surgical procedure to remove this pterygium as well as cystic change in the pterygium itself can lead to the development of epithelial cysts. So it can be one of the complications that arise in patients who are suffering from a pterygeal membrane or on their cornea or on their conjunctiva. The aqueous cysts, they occur due to the healing of the cystoid cicatrix formation. So any cicatricial conjunctivitis. Cicatricial is a word that is basically relating to the granulomatous tissue that basically forms after the healing process starts on. It can be after a trauma. It can be after an infectious state, that is basically any chronic infectious state that occurs in the conjunctiva of the individual, and that leads to the formation of cicatricial tissue. Now, cystic changes can occur or they can arise in the cicatricial tissue that has been formed, and that basically leads to the formation of these cystoid masses in the conjunctiva, either bulbar or either the fornical or tarsal conjunctiva. Then on the other hand, we have the pigmented epithelial cyst following a topical use of cocaine and epinephrine. So these drugs and substance abuse is another point that we have to consider when we are taking the history from the patient. All of these etiological factors basically lay down whenever we are investigating a case of cystoid lesion in an individual, and we want to know what can be the causative factors. These points we have to remember. These etiological factors make it quite easy for us to get to know the exact points, or just jot down the exact points of history taking whenever we have these patients of cystoid degeneration or a cyst that has been formed in the conjunctiva of the individual. The treatment of the cystic conjunctiva, obviously, it consists of the careful surgical excision. Obviously, topical treatments won't be quite helpful except for the symptomatic treatment, for example, the relief of the itchiness or the relief of the grittiness that is being caused due to the cystic formation in the conjunctiva. But we'll have to stick on to the surgical excision of the cystic lesion. And finally, after the surgical excision, we'll be sending this cyst for the histopathological examination. That is basically the biopsy of the cystic lesion, and that is again going to reveal the final diagnosis in the individual. Whenever the patient comes up to you with this particular mass in his or her eyes, you don't know whether it's of a benign origin or either it is a malignancy that is occurring in the individual. So we have to differentiate between these two whenever we are sending this for the histopathological examination, and that would basically finally reveal the basic status of the cyst that we were working on. On the other hand, once we have dealt on with the cystic lesions, there are the tumorous conditions of the conjunctiva. Again, as we classify the cyst that can be of the benign origin or they can be of the malignant origin, the tumors itself can be even of the benign origin, and on the other hand, they can be of the malignancies that can arise in the individual. We'll be over here differentiating or classifying the tumors of conjunctiva clinically, and the clinical classification would obviously base on the physical appearance of the tumors. That is, either it is a non-pigmented tumor that is having no color or a whitish, yellowish color, or either it is a pigmented tumor that is a blackish, brownish discoloration to the tumors are quite significantly seen clinically in a lot of cases. So the causative factors for the development of the non-pigmented tumors can be a lot of congenital tumors that can arise in the individual. We have dermoid and we have the lipodermoid, that is also known as the choristomas. Lipodermoid cysts are basically when there is a collection of fatty layer around the cystic lesions. We always consider this kind of a cystic lesion to be a lipodermoid cyst. On the other hand, the characteristics of a dermoid cyst are quite common. Usually the limbal area is the most commonest site for the development of the dermoid cyst. There are multiple risk factors for the development of this dermoid cyst. It can range from the exposure to the ultraviolet rays, a lot of chemical exposures, chronic infections pertaining to the viral, bacterial, fungal, parasitic infections, or it can be even the autoimmune disorders that can finally result in a dermoidal cyst in the individual. Whenever we say it's a congenital dermoid cyst, what would be the contents of such a cyst? It would be usually the hair, it would be the infiltrative cells, and that would be the final constituents of a dermoid cyst. There would be an epithelial layer, a membrane that is covering the dermoid cyst, and then it would be covered up with hair or some of the cellular infiltrates, and that's it. On the other hand, if we have a lipodermoid cyst, it's going to have an additional fatty layer, a layer of fat cells that is going to be an additional factor in cases of a lipodermoid cyst. We have the benign conditions that can arise in the non-pigmented tumors. For instance, we can have papillomas, we can have adenomas, fibromas, and on the other hand, we can have angiomas. So as the name is indicating, if it is a papilloma, it would be just related to the papillitis or quite similar to a condition, a follicular condition that arises in the bulbar part of conjunctiva. On the other hand, if the glands are involved, it would be a case of adenoma. It can be the glands of Cross. It can be the meibomian glands that are lining the lids, or it can be a fibroma that is basically involving the fibrous tissue layer of the conjunctiva. And on the other hand, we can have the vessels that is basically involving the vascular layer of conjunctiva. And that would basically termed as the angiomas. And they would have their own peculiar features. A papilloma can have it's basically all of them are the non-pigmented tumors. There won't be any brownish or blackish discoloration. Either it would be a yellowish or a whitish discoloration that is given off to such kind of benign tumors. Whenever we are considering these congenital or benign tumors, they can go to some precancerous condition, premalignant conditions. That would depend upon the differentiation of cells. When it is sent after the surgical excision for the histopathology, we'd be looking at the type of cells and the type of undifferentiated cells that it contains. And that would basically give the final consensus on whether it is a benign or whether it is a malignancy that we're dealing with. Intraepithelial epitheliomas, and that is also known as the Bowen's disease, and that was basically include the basement membrane along with the epithelium of the particular conjunctiva that it has basically focused on. The malignancies can also arise. That basically includes the squamous cell, and on the other hand, we have the basal cell carcinomas. Initially, obviously, when we are dealing with these kind of tumorous conditions, it's not always a case of squamous cell carcinomas that we're dealing with. If it's just the epithelial layer that is being involved and the basement membrane is spared in this condition, that would basically relate to the benign particulars of this particular condition in the patient. Now, regarding the pigmented tumors, once we have dealt with the non-pigmented kinds of tumors that are present in the conjunctiva, we have another variant that is basically giving off a brownish or blackish discoloration to the tumor's conditions. We have the benign variety over here again. Then we can have basically the nevi and the congenital moles, which are included in the benign variety of the tumorous conditions of the conjunctiva. There are a lot of precancerous melanosis conditions in which basically there is a melanoma that arises in the conjunctiva, giving off a brownish discoloration, which can be blackish in a lot of conditions. And it's again a benign condition. It is, although a precancerous condition, that means that it can basically mutate towards a cancerous conditions. Melanomas and lentigo maligna, these are the conditions that can arise over here. They are basically small tumors giving off a pigmented appearance, and they are precancerous in their nature. On the other hand, we have the malignant variety of tumorous conditions of the conjunctiva. There are a lot of malignancies or cancerous conditions that can arise depending upon the differentiation of the cells. So the histopath would be the final consensus that would decide whether a particular condition is benign or either it is a malignancy that we are treating. Primary melanomas are the most notorious kinds of the malignant tumors that we usually come across. Again, we would take the history from the patient for how long the condition has been there. Were there any risk factors that made the person prone to the development of this precancerous or cancerous condition? Would be an additional factor. Family history, environmental history, any history of chronic inflammations would make the person more prone to the development of cancerous conditions or malignant conditions, in other words. The dermoids, when we talk about them, they have their particular appearance. They are non-pigmented in their nature, so it's basically the solid white masses that are mostly fixed to the cornea. It can be the limbal region that is involved in a lot of cases. It can be the bulbar conjunctiva. Then the composition is basically the collagenous connective tissue. We have hair, and we have the sebaceous glands that are included in this. These are basically the final components of this kind of a dermoid cyst that is present over here. Now, how do we treat these cases of dermoidal cysts? It's basically through simple excision that we perform in these cases. And obviously, after excision, we are going to send this particular cyst for further histopathology, and the final consensus would be the diagnosis that is made after the histopathology report has been concluded. On the other hand, we have the lipodermoids. They are basically the congenital tumors at the limbus, or they can be present at the outer canthal margins. So these are the commonest sites for the development of such a lipodermoidal cyst. Then we have, it can be associated with a condition which is known as basically the golden hairs syndrome, in which we have the lipodermoidal cysts, as well as there are the particular features for the, there are particular irritative features as well. They are coupled up along with the presentation of a lipodermoidal cyst. It also consists of fatty tissues and dermis, for instance, connective tissue. The benign tumors, that is the simple granulomas, they basically include the polypoids. There is this particular cauliflower-like growth that is present whenever we have the simple granulomas. The surgical excision is required for these simple granulomas. What are the etiological conditions? Again, it is basically a long-standing infection that led to the formation of this granulation tissue on the conjunctival membrane. Then we have the papillomas, on the other hand, that is basically a benign polypoid tumor, which is basically undergoing a malignancy change. So it would be, first of all, a polypoidal tumor. The papillomatous appearance would be quite visible on the bulbar as well as the dorsal part of the conjunctiva. And these appearance of the follicles and the papillomas would undergo a malignancy change in particular. The fibromas are quite rare. They are soft or hard polypoidal growths. So these are the different sorts. We have papillomas, fibromas, and on the other hand, we have simple granulomas that can be included in this kind of benign conditions. The premalignant tumors are basically also known as carcinomas in situ. So they are the tumors that have the tendency to move on, or they can differentiate into the carcinomatous conditions as well. The Bowen's intraepithelial epithelioma are quite notorious over here. It's one of the conditions in which the Bowen's membrane or the basement membrane is involved. The particular differentiating features are the main features over here that basically would be consisting of the particular differentiating features. As you can even appreciate over here, this is one of the kinds of the intraepithelial epitheliomas. Again, traumas, infections, and a lot of allergic conditions make the more person prone to the development of these precancerous conditions, quite common in the patient. The malignancies would include the squamous cell carcinomas. Once you have this picture of squamous cell carcinomas, they are quite typical in their presentation. There is this thickened membrane that can be quite differentiated from the other sorts of benign kind of tumors or benign cysts. So this picture is quite typical. The hemorrhagic conditions can arise in the eye along with this squamous cell carcinomatous conditions. We have one of the varieties, which is basically the ocular surface squamous neoplasias. The properties would consist of a wide spectrum of dysplastic changes that occur in these sorts of neoplasms. We have the squamous dysplasias that are basically the carcinomas in situ, partial to full thickness intraepithelial neoplasias, and then we have only a few CINs that basically are progressing to the squamous cell carcinomas. There is a wide range of etiological factors that would push up a precancerous condition to develop into a full-blown cancerous or a neoplastic condition. A continued exposure to the ultraviolet rays, continued exposure to the allergens in our environment would make the person more prone to the development of this kind of carcinomas in situ. The risk factors would obviously include the xeroderma pigmentosa. It's another condition that can arise in a patient. And the history taking would obviously be of particular concern over here. You have to ask the patient if he or she has been suffering from any long-standing autoimmune disorder, any long-standing infections, because these conditions can make the person more prone to the development of this cancerous or malignant conditions that can arise in the conjunctiva of the individual. Intense ultraviolet radiations or exposure to the intense ultraviolet radiations, though it's basically the occupation and the environmental conditions that are quite peculiar for the development of such a condition in the patient. The history of squamous cell carcinomas in the head and neck. So the past history, the past medical, the past surgical history, I'm emphasizing on this point because that is the particular points of history that would reveal if the patient can suffer from malignancies or if he is more prone to the development of malignancies or not. Cigarette smoking is another risk factor, and then we have the pertaining conditions are the prevailing AIDS and the herpes papilloma virus. These are the human immunodeficiency virus and the papilloma virus. These are more notorious for the development of the malignant conditions in the patient. And then obviously finally we have the advancing age. According to the advancing age, according to a lot of researches and studies that have been conducted, advancing age is one of the risk factor for the development of squamous cell carcinomas. The pathogenesis would consist of basically, first of all, the P53 mutation. So this is a very significant mutation that can lead to the development of this kind of ocular neoplasm. Then we have the CD44 mutations that are again quite notorious. We have the c-KIT mutations that are quite notorious, and then we have the ABCG2. So these are the particular mutational changes at the genetic level that can give rise or that can give way to the development of this ocular surface squamous neoplasias. These are a kind of the squamous cell carcinomas that can arise in the conjunctiva of the individual. P53 is basically why expression of the keratins and the delta NP63, COX2, and the EGFR. Then obviously CD4, that is basically a non-putative limbal system stem cell marker that is basically giving way to the ABCG2. And many cells with CD17 and CD44 show high expression of the ABCG2. So this is the final pathogenetic or factors that are taking place at the genetic level, and they're contributing towards the development of these neoplasms. The clinical features would obviously include the leukoplakic forms that arise. It's basically a focal thickening of the epithelium that arises in the conjunctiva. And then we have the papillomatous forms. Specifically, they are contributing towards the canthal folds over here. It's basically a well-defined, soft, vascularized mass over here. And then there is a formation of the gelatinous form. So these are the particular stages of the clinical features. We have a plaque formation that is then basically mutated to a papilloma formation, and finally there is a gelatinous form that appears in the conjunctiva. It's ill-defined, it's translucent, and obviously we note down the thickening of the conjunctiva along with these features. The treatment would consist of, obviously, whenever we have this tumorous mass, and it would obviously depend upon the encroachment on the cornea as well. So we'd be basically excising the tumors surgically. This is the final mainstay for the treatment. It can be obviously coupled up with the chemotherapy and the radiotherapy in a lot of conditions. We'd be focusing on the cryotherapy, and then obviously after the surgical excision and after the tumor has been sent for the histopathological examination, we would be prescribing the patient with the topical antibiotics, the topical chemotherapies that are performed if there is a final diagnosis of the ocular surface squamous neoplasia in the patient. We would revert to topical chemotherapy in these patients. Then we have another variant. Regardless of the squamous cell carcinoma, we have the other variants which are basically relating to the basal cell carcinomas that can arise in a lot of situations. It may invade the conjunctiva from the lids, and basically the patient would give you a history of a basal cell carcinoma that he or she may be suffering from in either of the lids, and that basically prevailed onto the basal cell carcinoma of the conjunctiva in this patient. It may arise pari passu from the plica semilunaris. So plica semilunaris, as we all know, it's basically the semilunar membrane at the medial canthus. And if it is the basal cell carcinoma of the plica semilunaris, it can even invade the conjunctiva in a lot of conditions. It responds favorably to the radiotherapy. So after there is a surgical excision, we can couple up the therapy with the topical chemotherapeutic drugs as well as the radiotherapeutic drugs in these patients. And obviously, we are going to revert to the complete surgical excision of the tumor. That would be the final treatment that we would get for any squamous cell carcinoma or any basal cell carcinoma. You have to make it a rule. If it is any kind of a carcinoma or a malignancy, surgical excision is inevitable in these cases. The pigmented tumors, they consist of the nevi. It's basically, it can be, the size is quite variable in a lot of cases. It can involve the bulbar conjunctiva, the palpebral conjunctiva, sites, and even the sizes of these nevi are quite different in different cases. And it's usually a benign condition, but it can be a precancerous or a malignant condition as well if it is exposed to the chronic irritative functions. Then the appearance is again very important. The size, the site of the nevi, all of these have to be noted down. Usually it's a gray, gelatinous, brown or black nodules that are seen in the patient. The histology would resemble the cutaneous birthrin that is usually present in these patients. When we excise these nevi and they are sent for the histopathological examination, usually the patient would be giving you the history of the benign features, and all of these are usually the benign features, but still the treatment would consist of excision, and sometimes it is coupled up with the topical chemotherapy. Usually it is indicated for the cosmetic reasons. So it's although a benign condition, but still we have to excise it in a lot of cases for the cosmetic purposes. Then there are a lot of precancerous conditions. For example, melanosis is one of the precancerous conditions that we usually deal with. Now, melanosis is basically a pigmentation that arises usually in the bulbar part of the conjunctiva. It's more prominent. It can encroach upon the cornea, and when it is involving the pupillary region, it is going to affect the visual acuity in the individual. So all of these conditions, for example, if it is melanosis, we cannot really ignore this condition because it's not always a benign condition. We have to basically send for the histopath, excision is done, and further studies are basically done after the excision. And then only you can decide what kind of a treatment modality you are going to design for this particular patient who is suffering from a precancerous melanosis. The characteristics of the precancerous melanosis would basically consist in adults. It would be a superficial spreading melanoma that the patient is suffering from. The clinical features would be it's a small pigmented tumor and it spreads as diffuse and asymptomatic patch. So it's usually not a raised patch that we're talking about. It's not a cyst. We can usually just differentiate it from the pigmented cysts or from the pigmented patches. It's usually a diffuse patch that is present. And that is the main characteristic over here in the melanomas. The treatment would consist of a local excision with post-operative radiotherapy that is given to such patients. On the other hand, we have the other variants, which are known as the malignant melanomas. Now, whenever we are dealing with these sorts of malignant melanomas, we have to keep in mind that these can be quite invasive. Sometimes these malignant melanomas can invade the cornea, as well as it can involve the pupillary region, the region of the lens, as well as the scleral indentations are quite common when we are talking about these sorts of malignant melanomas. So even if it's just a diffuse patch which is giving off a brownish or a blackish discoloration, it cannot be benign in a lot of cases. Further investigations are done, CTs and MRIs are done, and that would basically reveal, the radiographic studies would particularly reveal the invasion of such melanomatous conditions that we can deal with. Obviously, the treatment would depend upon the staging of the melanoma and the malignancy. If it's a case of a particular invasion, we have to sometimes perform the enucleation in these cases or the complete excision of the eyeball. Obviously, after this complete enucleation that we have performed, we have to basically provide the symptomatic treatment to the patient as well as give the cosmetic review to the patient to have a better quality of life. Prosthetic eyes are obviously implanted, and it's one of the choices for a better cosmetic outcome in these patients after they have been fully treated. After a complete excision, obviously, you would couple up the therapy with the radiotherapies as well as the topical and the systemic chemotherapies that are sometimes implied for these patients of malignant melanomas. The prognosis in these cases of malignant melanomas are quite well. If it's just the early stages of the malignancies, it can be quite a better prognosis, and specifically if it is coupled up with the radiotherapy, because it responds quite well to the chemotherapeutic features as well as the radiotherapeutic features. The characteristics of the malignant melanomas would be the particular origin that it has. So usually the particular site for the development of these kind of malignant melanomas is near the limbus. Usually it's encroaching upon the cornea. As I've already mentioned, it's involving the pupillary region, it is encroaching upon the cornea, it is involving the limbus, as well as the bulbar part of the conjunctiva are sometimes involved. Although there can be the arisal of the de novo sites, that is the tarsal conjunctiva, the palpebral part of the conjunctiva can also be sometimes the case in particular patients. The clinical features over here would consist of the pigmented or the non-pigmented masses that can arise near the limbus. So the melanomas, even if the name is indicating upon a particular pigmentation that arises, it can be even a case of a non-pigmented melanoma that we're dealing with. The histology would reveal the alveolar cells, the round cells, or the spindle-shaped cells that are quite commonly found in these cases of malignant melanomas. The treatment guidelines would include the enucleation, that is the complete excision of the orbital structures, as well as the extenturation that is performed in these patients. So over here in this particular lecture, we're concerned with the cystic lesions of the conjunctiva, as well as many tumorous conditions that can arise in the conjunctiva. We can further classify these lesions into either benign, the precancerous lesions, or either it can be the malignancies that can arise in the conjunctiva. So one should be well versed with these conditions and how to go about and manage these cases of either benign or the malignant conditions that can arise in the conjunctiva of the patient. So that is the end of this lecture. Thank you for watching sqadia.com.